everyone, my name is Janelle Ramirez, and this is my Health Career Connection Summer 2021 presentation. I was placed at UCSF Parnassus in the kidney transplant department. So a little bit about my background. I was born and raised in Vallejo, California, and I went to UC Berkeley for undergrad. I actually graduated in 3 years this past spring with a BA in public health. And my initial interest going into this internship was to learn more about hospital administration and health policy to see if it was a good fit for me. And my current goals include pursuing health policy, program management, and community engagement. So about my host site, I was placed at UCSF Parnassus in the kidney transplant department as an administrative intern. And some of my projects included assisting with prepping and opening a whole new clinic wing for our department for the kidney transplant center. Here in this picture, you can see kind of what a setup of the room looks like. I helped prep 12 rooms of those for the CDPH inspection, and we passed, and we are well on our way to treating patients there. I also managed at Transplant UCSF on Twitter and just helped kind of tweet daily or daily on this page on Twitter. And my final pretty big project was the no-show list project, which I learned how to work with and utilize electronic health record systems, specifically Apex and Titus, to reach out to patients and improve patient attendance to mandatory scheduled appointments. Because if someone has a transplant, a kidney transplant specifically, you must get checked every year. And if you miss that appointment, gets a little concerning. And so that was kind of my project to kind of try and mitigate a lot of these patients who were kind of canceling or no showing to their appointments. And here are some more photos. This was me at my desk, and I eventually moved to this kind of more open office space, which no one was using. And this was kind of the view that you could see from our 7th floor clinic. So it's pretty nice, and it's really nice that everything's renovated. All of the office spaces look like this now with 2 monitors and a keyboard. It's really great. And so for my overall experience, my preceptors were really great. Shout out to Marco and Cynthia. And the network that I found there was very vast. There were plenty of connections available. I met with many people. For example, I met with the executive director of the kidney transplant department. So that was really cool. And another thing that I noticed when I got there, the prestige is real. Reputation can weigh heavy on a resume. And some of the workers there were also telling me yeah, it's just having it on your resume is really good. And I kind of agree, but that doesn't mean it's everything as well. So, and my experience there was very patient-centric. I gained a lot of technical skills that are highly applicable to hospital settings. And the last thing is administrative. I learned so much about the administrative side of healthcare and hospitals. A lot of work goes in on that end to make sure all of the doctors and the patients feel comfortable and can work efficiently together. And so for my internship impacts, I learned that hospital administration may not be the best fit for me. I kind of want a more hands-on role and kind of my communities and centering the populations I want to serve. And for health policy, I would like to learn more and work more in this area. I'm very interested in fighting for health for all, as well as furthering Medicare and Medi-Cal funding for very underprivileged communities. And thirdly, community engagement. I would like to focus my career more around my communities. And I feel like it is harder to do that when you're in a hospital administration. So yeah. And lastly, program management. I learned more about what a program manager is and kind of this kind of field and how it works into health from my preceptor. And I actually secured a full-time program manager position at Partnership Health Plan in California, Partnership Health Plan of California in Fairfield. And I will be starting that next week. And so yeah, thank you so much for listening and watching. I had a really great experience here at UCSF, and I couldn't have asked for a better experience, honestly. It was very eye-opening. And yeah, thank you.